Hello, I'm Dr. Delp with your tip of the week. This week we're going to discuss breastfeeding and how important it is. First and foremost, let me say if you have a certain condition that prohibits you from breastfeeding, I understand, but I wanted to speak to those that are on the fence, debating on whether they should or should not. If you are, I'm going to back up why it's so important that you should do it. If you're on the fence, which so many mothers are nowadays, then definitely consider this is one of the best things you can give your child. First and foremost is immunity. Your first 6 months, your child is not developing, has not developed his immune system. In fact, there's a lot of talk why many parents are waiting or postponing vaccinations till they're 2 or 3 years old. And there's a lot of evidence that's a good choice because the child's immunity is not developed. In fact, in Japan, the incidence of sudden infant death syndrome dropped almost non-existent just by postponing to age 3 for vaccinations. Now, I'm not here to discuss vaccination, whether you should or should not. You should do what you feel is right. But what I want to talk about is the immunity that you can give your child by breastfeeding if you choose to vaccinate. By choosing to vaccinate, you are introducing your son or daughter into some viruses. And so by breastfeeding, it boosts your child's immunity. They get their immunity from you. In fact, besides getting a lot of beneficial vitamins and minerals from the breast milk that they can't get easily from other places, they also get the IgG immunoglobulins. And what they do is they're some of the only immunoglobulins that can cross the placenta and into the child. And it actually gives your child that immunity. It actually gives your mother's immunity. And that's why most mothers are less likely to develop sickness while they're breastfeeding, and children that are breastfed are less likely to get sick. You actually are helping to give your child its immune system until it develops its own, which can take at least 6 months to develop, and sometimes longer depending on what's going on with the child. That's one of the greatest reasons. In fact, IgG antibodies make up 75 to 80% of your immunoglobulins, that's in your blood. So very, very important one, very, very large one, and that's one of the immunoglobulins that fights viruses and bacteria. So very, very important. Second thing is it makes it easier on the parent. And you'll say, I started, it was challenging. Usually for the first couple weeks. My wife was breastfed. She's breastfed for almost 44 months. She's a trooper, and I respect her utmost by doing that. But what can help is that instead of having to get up at night and run and make formula, then you can just roll over, do what's natural, let the baby grab towards you, and then it actually is easier on the mother, much easier on the child, and easier on daddy as well, which we know that mom is probably the most important one on that one, but nonetheless it's easier on the family. Third thing is cost effectiveness. Much more cost effective because you're producing a much superior product than you can ever get in stores. Anytime a synthetic formula says it's as good as mother's milk, it's not accurate. There's no way they can reproduce what you're making already. The colostrum and a lot of other good benefits that you have from breast milk is just amazing. Definitely a great idea. Fourth thing is that, and if you bought formula, first of all, you know how expensive that can be. You can run into hundreds of dollars a month, besides the diapers that you're already purchasing. The last thing would be there have been huge studies that's been done on mothers who's breastfed and developing breast cancer. The incidence of breast cancer decreases dramatically as the longer you breastfeed. Typically, they say you need to breastfeed for at least a year to really take advantage of that. So if you're breastfeeding for a year, the numbers drop, and they say that there's some researchers that say that in 4 years that's almost non-existent breast cancer in mothers that have breastfed for 48 months. Now that doesn't mean straight. That could mean your first child, your second child, even third child. And that's why they find that a lot of mothers that have a lot of children have a lot less injuries of ovarian and uterine cancer, as well as in breast cancer as well. It actually makes them healthier. There's a lot of different thought process on that, which we won't get into today. But the research article, one of the research articles that I used was Lancet, and it was from 2002. It was the 360th article, and it was page 187 through 195 if you'd like to look that up. But breastfeeding is really not only is a benefit to you and your family as far as cost and time, but also it's the biggest benefit for your child. Help your child grow to be a healthier, happier adult. Thank you, and thank you from Delp Chiropractic.